When times are tough, it's harder to take care of yourself and be healthy. And our organization, Healthy Start, can help women who are having a hard time in life get the basic services they need, not only prenatal care, but also counseling services, help to quit smoking, nutritional education and breastfeeding education, all the things that will make them have a healthy pregnancy and help their baby to be born healthy.
The trends have consistently been increasing. Our birth rates in Sarasota have been increasing. The need then for the population that we work with, which is our risk-based population, women that are at risk for loss or preterm labor, preterm outcomes, has continued to increase. The needs have increased recently because in the last 2 years with the shortages in funding and the changes in funding streams and so forth, we've seen actually greater needs with our clients. Services that were provided at other agencies are being cut, which is then increasing their demand on services here at Healthy Start.
Well, when I first got introduced to Healthy Start, I was incarcerated in jail for drug use, and I went to the Sarasota County Health Department, and my Healthy Start worker tracked me down, and she asked me if I needed anything, any help with anything, and I told her that I needed help with baby clothes, baby, strollers, bassinets. I needed clothes for myself, and I needed her to help me get all of this stuff because I couldn't do it on my own. I had no financial way of doing it.
Healthy Start got involved because I am in a drug program. And they automatically come out to help the mothers because we've made bad choices, but we're trying to better ourselves. So Healthy Start steps in, and if there's anything they can do to help us, then they do for us.
Healthy Start in general has help with other services, counseling. I see a counselor, Mary St. Aubin, and I see her for grievance counseling. Also Chip. He comes help me with not smoking. He teaches me to be mindful and to quit smoking cigarettes. So Healthy Start pays for all that.
And they help me with counseling. They helped me get car seats for my children. They've helped me just in answering questions I had, reassuring me as a mom, making me feel better about me instead of sometimes you just second guess yourself, and they're there to help that.
Well, this is my second child. This pregnancy is kind of different from the first because it's my first full pregnancy. I had my son at 24 weeks, so it was a premature birth. This one, I think she's gonna come earlier than May 21st because I've been having contractions for the last 3 days. And it's kind of hard because I don't have Medicaid, and they're going to cut my Medicaid off, my pregnancy Medicaid at the end of this month. So I don't know how I'm going to do anything without Healthy Start.
A healthy baby, when born, costs only about $3,325 for the hospitalization. First-year medical costs for a premature infant are over $32,000. Not only are the costs an issue here, but the quality of life for the family and the future of the infant are at stake.
I'm kind of scared because I believe that she will come too early, and I don't want that because then I won't have the money to pay for her to stay in the hospital, and that's going to be really hard, and my spouse doesn't have the money to pay for it either, so we're just going to be like stuck because if they cut the funding, we'll be stuck. We won't have any help from anywhere.
I mean, if it wasn't for Healthy Start, I wouldn't have the things that I have, the clothing that I have, the bassinet, the car seat. It would still be a very stressful time in my life, and instead, due to Healthy Start, it's made things a lot easier. The stress of worrying about the baby needs are gone, so I can focus on making sure that she's born healthy, and to me that's the most important thing.
After I've had my baby, she's helped me with getting formula, cereal, a bundle that's got baby clothes in it. When you run out of formula, because WIC only pays, provides a certain amount each month, then you run out and they'd have to pay for it, which is really expensive. She's on a hypoallergenic formula, Nutramigen, which is $30 a can of formula, and she'll go through a can of formula every 2 days. So you know, Healthy Start will help with that kind of stuff.
My hope for the future is, number one, that she's born healthy. She's going to be born clean, thanks to Healthy Start and mothers and infants. And that she will never know the struggles I went through up until this point. You know, so just that she's a happy baby.
My hopes for the future are pretty much to have a healthy baby, a clean one at that. I would like to have the help that I need to get there, because without Healthy Start, I don't think I'll be able to, you know, financially be able to take care of the children.
As we've seen in the last few years, we're reducing more of our services to the most highest risk. We're going to, see more and more people and women that might not be getting prenatal care, might not know where to go to get the services, and then are not getting the care they need. Our risk factors are continuing to increase. The number of our highest risk are continuing to increase, and they increased through 06 and 07, and when some of the funding cuts started, we've had to sort of cut back on the numbers of clients we can see, and we've seen that it's affected, but we still see the trend is up in terms of our highest risk clients.
Healthy Start funding benefits the community through the promotion of health of our current and our future generations. At this time when economic stress is reaching us all, I ask that you not cut funding to Healthy Start. Our young families will be needing more assistance, not less.
I think the state has always been extremely supportive of the Healthy Start program. They have consistently seen the need and seen the value in this program, and I would just hope that we continue to get the support that the women in this county really need.